So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about how far can someone without symptoms spread the infection. So the signals so far are that some people spread the COVID-19 before showing symptoms themselves. Can some also spread the disease without ever showing symptoms? A look at the emerging evidence. Two recent figures given out on separate days by the Indian Council of Medical Research about people without symptoms testing positive for novel coronavirus disease has created fear about the possibility of unsuspecting individuals suddenly falling very sick and of their infecting others. A look at the evidence and the guidance on asymptomatic cases of the COVID-19. What has the ICMR said on this? On April 20, Dr. R. Gandagekar, head of epidemiology and infectious disease at ICMR, said, "I have explained that 80% people will have infection without symptoms. They will also be asymptomatic, but if you test them, there is a chance that they will be positive. We need to understand that the RT-PCR test comes positive only after a person is symptomatic. People take time to be symptomatic. This means if one tests him when asymptomatic, the chances of him and her testing positive are small. This, he said, is a limitation of the test. The closer one is to the point of the infection when the disease is contracted and non-manifested, the slimmer are the chances of the testing positive. That is also why, he said, India's testing strategy, which banks heavily on whether a person is symptomatic unless one is in hotspot with a known history of contact with a confirmed case, does not need any immediate revision. The following day after this led to apprehension, Dr. Gandagekar clarified that in India 69% of the people who had tested positive are asymptomatic. What I said yesterday about 80% of people is based on one study, he said. What is the evidence on this? It is now widely understood that around the world, the bulk of the people who get infected will not show symptoms and will probably not even know that they have contracted the virus unless they are subjected to serological test at some point and are found to have 12 antibodies. Last week's study from the China concluded that 44% of the cases who had contracted the disease had caught it from an asymptomatic person. They estimated that viral shedding, which is when a person infects another, starts happening 2 or 3 days before the onset of the symptoms. We observed the highest viral load in the throat swabs at the time of the symptom onset and inferred that infectiousness peaked on or before symptom onset. We estimated that 44%, 95% of confidence interval, 25 to 69% of the secondary cases were infected during the index cases. Presymptomatic stage in settings with the substantial household clustering, active case finding, and quarantine outside the home, reported the researchers including from the Yangzhou Medical University and the World Health Organization collaborating Center for Infectious Disease Epidemiology and Control at the University of Hong Kong. The study was published in the Nature Medicine. But what is presymptomatic stage? The World Health Organization recognizes 3 stages of the COVID-19 transmission: asymptomatic, presymptomatic, and symptomatic. Symptomatic transmissions refers to transmission from a person when they are experiencing symptoms. Data from published epidemiology and virological studies provide evidence that COVID-19 is primarily transmitted from symptomatic people to others who are in close contact through respiratory droplets, by direct contact with infected person, or by contact with contaminated objects and surfaces. The WHO says the incubation period of the virus ranges between 5 to 14 days. Presymptomatic transmission is when a person spread the disease before symptoms appear and eventually develop symptoms themselves. On asymptomatic transmission, the WHO says it refers to the transmission of the virus from a person who does not develop symptoms. There are few reports of the laboratory confirmed cases who are truly asymptomatic, and to date there has been no documented symptomatic transmission. This does not include the possibility that it may occur. Symptomatic cases have been reported as part of the contact tracing effort in some countries. The U.S. Centers for Disease Control and Prevention series is clear that both presymptomatic and asymptomatic transmission of the virus are possible. The onset and duration of the virus shedding and the period of the infections for COVID-19 are not yet known. It is possible that the SARS-CoV-2 RNA may be detectable in the upper lower respiratory tract for weeks after illness onset, similar to infections with MERS-CoV and SARS-CoV. However, detection of the viral RNA does not necessarily mean that infectious virus is present. There are reports of the symptomatic infections and detection of the virus with no development of the symptoms, and pre-symptomatic infection, detection of the virus prior to the development of the symptoms with SARS-CoV-2, but their role in transmission is not yet known. Based on the existing literature, the incubation period, the time from exposure to the development of no symptoms of SARS-CoV-2 and other coronavirus, example MERS-CoV and SARS-CoV, ranges from 2 to 14 days, the CDC says. How does one protect oneself from asymptomatic transmission? There is no alternative to basic safety practices such as hand washing, wearing a mask, and social distancing, said Dr. Randeep Glera, AIMS director and respiratory medicine specialist. There is still such time that medicine vaccine is found. This is why universal precautions such as social distancing, hand washes are so important. Maintaining distance is also very important, but stigma only ends up increasing mortality and morbidity. You have to understand that many people, especially given on how young our countries, would go through a bit of fear and body ache and not even know that it is COVID. The question of the transmission from an individual who does not show symptoms is also important. While evidence on asymptomatic individuals spreading the disease may be divided, it is more or less accepted that people can spread the disease before they show symptoms. For how long a person can spread the disease after being infected by the virus, the reply to this question is commonly assumed to be 14 days. However, it is a new disease. Knowledge about it is evolving. In Kerala, recently, a 54-year-old woman tested positive test for the virus almost a month after she arrived from abroad and had been quarantined at home ever since. Health official told the news agency that there have been at least a dozen cases so far of people testing positive after having quarantined for 28 days. On Thursday, Telangana decided to increase the home quarantine period to 28 days from 14 days. The Union Health Ministry had advocated from the very start that patients should be followed up at least through community surveillance for 28 days and not 14 days. This is also in line with some of the global expenses in a study last month. In the Lancet Infectious Disease researcher from Imperial College London estimated that in China, the mean duration from onset of symptoms to death to be 17 to 8 days, and to hospital discharge is to be 24 to 7 days. They also pointed out that all cases were hospitalized there and not much because they needed hospital care, but to prevent the onward transmission. So if you like the channel, so kindly subscribe to it.